The issue with mouth taping is when we improve our tolerance to our waste product, the nose tends to open up. When a child is born, their caregiver needs to be informed about the importance of nasal breathing. Puberty, pregnancy, and menopause, we have checked the breathing is more likely to become inefficient.
Let's maybe start from your introduction. Please introduce yourself.
So my name's Louise. I've been a GP for over 20 years now. I've had an interest in particularly in women's health since the beginning of my career. And in more latter years, I've actually realised that how we breathe is really important for health and well-being, partly because I came a perimenopausal snorer, which really affected my sleep. And then I realised I wasn't breathing as efficiently as I thought, and I improved how I breathed. My sleep, my exercise tolerance and stress resilience is way better. So I now work half-time as a GP and half-time as a breathing practitioner, because I share your passion that, you know, we don't always breathe as nature intended. And if you re-educate your body to breathe as nature intended, actually you can it can really help health and well-being.
So how do you exactly help people, and what is the outcome?
So it completely varies. So generally, I mean, I run sort of individual and group programs, and my aim is to reprogram or re-educate somebody's unconscious breathing pattern so it's efficient. So it involves various exercises to improve the tolerance to our waste product, but also it's about re-establishing 24-hour nasal breathing, because you know we've come into this world with a nose and it's been designed to breathe through, but for various different reasons we don't always use it to breathe. So it's about re-establishing that. So it might, you know, it takes a minimum of 3 to 4 months, because you're trying to make new nerve pathways, new muscle memory that's the unconscious breathing pattern. And it just depends. It's really, it fascinates me what symptoms can improve. So obviously all we're doing is improving how somebody is breathing. So I talk about 24-hour breathing efficiency. So we're improving that. And the symptoms that disappear will be the ones that are related to not breathing efficiently. So I never know at the beginning. I've got an idea which symptoms might be, but we're all different, aren't we? We're all different human beings. So I won't know, but generally the consistent ones are people sleep better, and they generally can exercise with greater ease. They feel less breathless with exercise, and they generally feel calmer. But I've had people who've regained the ability to smell. There was one lady who'd not smelt for 18 years, could smell again. I've had improvements in bladder control, you know, not getting up to pass urine at night, and even in the day. I think that's because we've improved diaphragmatic strength and pelvic floor strength, because the breathing's more efficient. What else have we had? I've had people's nose opens up. That's really common. They have a lot of nasal congestion if you're not using the nose to breathe, and that often opens up. I've had people's hay fever resolve. People's skin feel better, all sorts of things. I mean, essentially, we know if you sleep better, your body will heal better, won't it? It'll repair itself better when you're asleep. So anything can happen, really.
Amazing. How to switch to nose breathing? How to open the congested nose?
Yeah. So the first thing I would say is, can somebody actually breathe through the nose? So that's the first question, because obviously there may be an actual blockage that, you know, they need to go and see a ear, nose and throat consultant. So the simplest test, there is a study, it's a small study, but I found it really helpful, is I just ask if someone can breathe through their nose for 3 minutes. So literally just seal your lips, put a timer on for 3 minutes. Can you breathe through your nose? Now, some people will feel a feeling of like suffocation. So they'll feel, you know, you get your lips sealed, you know, you're still breathing, but you're releasing your waste product more slowly. Our waste product is carbon dioxide. So you're releasing that more slowly. And we've all got a personal tolerance to carbon dioxide. So we've got chemoreceptors in our brain. in our breathing centre, and when it hits our tolerance to it, we feel air hunger. So people might feel that as like, I feel a bit suffocated, or I feel like I want to open my mouth, or I'm not getting enough air in. It can vary in different people, and we've all got a tolerance to that, and actually a sensitivity to it. So, and sometimes just by closing the mouth, someone might feel air hunger. Now, if someone, so I sort of reassure them, if you feel a bit hungry for air, don't worry about it. I'll try not to. I'm just interested, can you actually breathe through your nose for 3 minutes? So I've had people who've felt quite uncomfortable doing it. And if I've got someone with me, I'll actually put an oxygen saturation probe on their finger and actually, show them that their oxygen level is normal before they close their mouth.
That everything is
and then
all right.
they close. Yeah, and exactly. And it's very powerful, that, because if you get someone who feels air hunger and they notice their oxygen level hasn't changed, it's eye-opening, because then, oh, well, when I feel like that, that's not oxygen, a lack of oxygen. It's not and I explain to them, this is a increase in your waste product. You've just hit your tolerance to it, and you can train that. And as long as someone can breathe through their nose for 3 minutes, generally you can re-establish nasal breathing. If you can't, then really you need to go and see an ear, nose and throat specialist, because there might be a more permanent blockage. We're trying to re-establish 24-hour nasal breathing, so that's when we're moving, resting and sleeping. But also, when we improve our tolerance to our waste product, the nose tends to open up. And that really is quite powerful. And I've been a GP for a very, very long time. I've used all sorts of nasal sprays to help nasal congestion, but it's a game changer. Improving your carbon dioxide tolerance is a game changer.
True. And that's a very good idea with the oxygen sensor. So the person can really basically keep calm and still holding the breath and build up the CO2. Regarding the 3 minutes breathing through the nose, when I was a mouth breather, I couldn't do that. Even 1 minute, I think, would be a problem for me. But I still was able to switch. So, so it's not like 100% no for people who can't, because they still may benefit from the exercises, from the therapy. How about people who have sleep apnea? Do they come to you?
Yeah, so I have a lot of people who come to me before they have a sleep study, because they don't want to be diagnosed with it. A lot of people feel uncomfortable with the thought of I think it's the treatment and having the diagnosis. So I see a lot of people who maybe their sleeping partner says they stop breathing during sleep, and they want to see what they can do themselves before they have to go for a sleep study. And what I say is, you've got nothing to lose by trying to improve your breathing efficiency, because if someone's happy, we could work on the breathing, say, for 3 to 4 months, see where we can get with it. Obviously, at the end of that, if someone's still stopping breathing during sleep, then obviously clearly they need to go for a sleep study. But there was an American workshop report that was created by the experts who prescribe and deliver CPAP. And they said their conclusion was nasal CPAP is more efficient, it's more effective and better tolerated than the full face mask CPAP, so CPAP is a treatment that is commonly used for obstructive sleep apnea. But the full face mask, generally, if you're a mouth breather, you need to use the full face mask. So my aim is, look, let's get you back to being an efficient nasal breather. So if you still ended up with a diagnosis of obstructive sleep apnea, you'd hopefully be eligible for nasal CPAP. And also, I've worked with people who are on who've got CPAP machines and mandibular advancement devices, which is another device that can be used for obstructive sleep apnea. And essentially, if you've got an inefficient breathing pattern, it's making those devices not work as well. So if we've got an efficient breathing pattern, you may still need those devices, but it'll work better for you. That's where I see. So I think efficient breathing is the basic foundation for sleep disorder breathing. There may be other factors. You still may need to see an ENT consultant or a myofunctional therapist or an osteopath, all different, there's all sorts of people that can help with breathing. But I think how we breathe over a 24-hour period is absolutely crucial.
Yeah, and it's also highly individual. Every case is different and complex. But do you see potential that someone with sleep apnea or any sleep disorder related to breathing, who actually switch to functional breathing, is there a potential that such person actually goes off the CPAP therapy?
I've had people who I think I think exactly what you say, sleep disorder breathing, and like it's specific, there's different types of sleep disorder breathing. So we've got upper airways resistance syndrome, we've also got obstructive sleep apnea, and obviously there's different severities of it. So I think the further down the pathway you are, I think it is more difficult to come off it. But I do think early in the journey, I think there's potential for that. I've had people who've come and their partners said they're stopping breathing during sleep, and then after the work I've done, their partner saying it's no longer happening now, and they've not got any symptoms to suggest to go for a sleep study. But I can't say I've cured their sleep apnea because I've not had a sleep study before and after, and I think they were probably at the milder end of the spectrum. I wear two hats, so with my GP hat I've got to wait until someone's been diagnosed with this before we treat it. But with my breathing hat on, I see this as a spectrum. I see this as, we need parents to know when a child's born. My child has come into the world nasal breathing. I need to assist that child to maintain nasal breathing through their life, because they'll get colds and a child will breathe through its mouth. But the parent needs to know, needs to know techniques to help open the nose, teach the child to blow the nose. And when the cold is gone, right, come on, let's get your mouth closed. But if parents are not told this, they don't know. And I think there is some sort of spectrum when our breathing deteriorates, and the sooner we intervene, the easier it is to reverse, I think. But there's different obstructive sleep apnea. It's not one condition, as you've alluded to. There's different phenotypes of it, so it's a bit complicated. But some will be more related to anatomy. I can help a bit with that because I talk about tongue position, getting the mouth closed, strengthening the muscles around here. The aspect of if we're over breathing, so that we call that loop gain, if we're significantly breathing in excess of what we need for our biological functioning, that's very amenable to the breathing work that we both gained from ourselves. So like the Buteyko technique, where it's helping to normalise the breathing volume, it's helping to normalise the reaction to our waste product. I think people who've got a big component of that sleep apnea, I think they can do really well. And there's other aspects as well, but so I think it depends on the person, and I think it depends on at what point you introduce this. If you're really, really well established severe obstructive sleep apnea, I think it can help. I think it's highly unlikely to reverse it.
Recently, I talk a lot to sleep apnea people, sleep apnea patients, and many different people who have problems with breathing. And what is very interesting, people with sleep apnea who are on the CPAP, the nose mask, many of them, they tape their mouth shut for the sleep. So some of them even seal completely the mouth, which I find a little bit dangerous, and even talking about that, it feels a little bit scary. But there is a group of people, they really do that, together with CPAP machine. What is your opinion? I mean, you probably heard of mouth taping. What is your opinion on that?
If we open our mouth, so as soon as we open our mouth, our tongue's in the wrong position. The tongue's at the bottom of the mouth, and the back of the tongue forms part of the airway. So as soon as the mouth's open, we've narrowed the airway. So if someone was laid on their back and they opened the mouth, I would say breathe in, listen and feel. So I can feel an obstruction, I can hear my breathing. Now I'm going to close my mouth and breathe in, but keep the tongue at the bottom of my mouth, so it's in the wrong position. So it's quieter because I force my body to breathe gentler and slower through my nose, but I can still feel an obstruction at the back. Now put your tongue in the correct position. So the correct position for the tongue is up on the roof of the mouth. You'll feel this lift as you do it. So you try and put as much of the tongue as you can on the roof of the mouth. A little tiny bit of light suction, not enough to cause a headache. The tongue is a strong muscle, so you don't want to put the tongue right up against the back of the teeth. So find that ridge of tissue above your teeth and put the tip there. If you can, put your teeth in light contact, But if you clench, so I clench when I do that, I just have a tiny gap in between the teeth. So no clenching, relaxed face, and your nasal breathing. Because if you've got your lips sealed, your tongue in the correct position, your nasal breathing, and now breathe in. So depending on your anatomy at the back of the throat, you can feel it's quieter, there's less obstruction. So one of the big things that I do on the programs is I'm teaching people to have that 24-hour nasal breathing pattern, but in addition to having the correct tongue position.
Yeah.
And if you do that over 3 to 4 months, you do wake up with your tongue in the correct position. So that naturally opens your airway a bit. Obviously, it depends on your anatomy and how much gap you've got at the back, because we're all different on the size of the airway. So if you've got your mouth open, you've narrowed your airway. So that's a problem. So we want to have our mouth closed. The issue with mouth taping is people just think of mouth taping. So if someone's breathing really inefficiently, they're breathing quite a big volume. They're breathing in excess of metabolic requirements. And you force them to close their mouth. You don't know the size of their nasal cavity. They may not be able to shift that amount of air in and out of their nasal cavity. And people can get what we call mouth puffing. So that's where people, they can't shift the air in and out of their nose. So the body's trying to force it out of the mouth, but because it's fully taped, it can't. And then essentially that can obstruct the airway further. But I do it in a program. So obviously I'm trying to normalize their breathing volume. I'm trying to make them breathe what they need, so to stop over breathing. But I ask them to wear a mouth tape that goes around the mouth. So I recommend myo tape, so it goes around the mouth. You sort of stretch it by about 30%, you stick it on, and it encourages you to nasal breathe. But if you needed to breathe out through your mouth, you can override it. So I see, as long as someone is not heavily sedated on drugs or alcohol, I see no danger with that in someone over the age of 4 who's able to, take it off if they want to, because you can breathe through it. And I do have clients at the beginning of the journey who say, "Oh, I'm still breathing through it." I was like, "Well, no, because we've not corrected your breathing volume yet, because the work that you'll do on the breathing exercises over time, your nose will open up, your body will accept and be able to breathe through the nose, and then your body will do it." But my slight concern is if we do full taping, but once the breathing volume is normalized and once the person's nose is open up and they've acclimatized to it, I think that's okay. But I think it's at the beginning, and I think sometimes people see on social media mouth taping and that's all they do. They're not thinking about the other aspects of breathing.
Exactly. I'm so happy that you said that. I'm actually, yesterday and today, I'm writing the blog article about mouth taping for my website, where I try to really redefine the mouth taping, because it's completely misunderstood because of the TikTok videos, Instagram videos, and people who just do it without actually doing any research. Basically, what you already said, that we need to have a correct oral posture before mouth taping, and we actually need to take care of our breathing habits during the day before mouth taping. So the good habits are taken into sleep. Then we can actually support ourselves by mouth taping. And of course, nasal breathing, the nose has to be open. Otherwise, it makes no sense. So thank you so much. How can we increase awareness among people and encourage them and re-educate them before that they get any negative symptoms related to dysfunctional breathing? What can we do about it?
So I think we need to see it across the spectrum, so across life. So I think when a child is born, their caregiver needs to be informed about the importance of nasal breathing. And I've got a blog on my website that we're now just in the process that our nurses at work, when they're giving we're probably going to do it at either their second or third immunisations, because we think when the child's about 8 weeks old, the parents are a little bit too sleep deprived to take on any extra information. So the nurses are going to just gently show the parents, look, your child is nasal breathing. That's how it's been designed to breathe. Dr. Oliver's got this blog that we'll text to you now. Can you just keep it? She'd like you to read it. She'd like you to understand the importance of a child continuing to nasal breathe through life. And I've referenced the reasons why it's important, particularly for child development. And I put references in, and there's suggestions to help people with lots of zero cost resources. So from that perspective, I think caregivers need to know it. I think females, breathing changes as during hormonal cycles. So in the 3 hormonal transitions of life, puberty, pregnancy and menopause, we have the breathing is more likely to become inefficient. So puberty, before puberty, we have more boys than girls have asthma, but after puberty, there's more girls than boys. So that's well documented. We don't have a lot of research on it. So something happens to their breathing around puberty. Pregnancy, we know there's a steep rise of sleep disordered breathing as women go through pregnancy, and that has implications for the mother and potentially the baby as well. And in menopause, we've got a steep rise in sleep disordered breathing, again for different reasons, but a steep rise in conditions such as obstructive sleep apnea. So and in all those conditions, hormonal transitions, we have puberty rhinitis, pregnancy rhinitis, menopause rhinitis. So at each of those, we are more likely to develop rhinitis, which is the medical term for nasal congestion. And if a person does not know the importance of maintaining nasal breathing, they'll just mouth breathe.
Yes.
And I would love women to know that, oh, my breathing might become inefficient at these points of my life. I'm going to assess my breathing before I hit there to know whether it's efficient. And if it isn't efficient, then I might actually put some effort in to improve the efficiency before I hit those transitions. I'd also like people to know that as we get older, our breathing is more likely to become inefficient. And I would also like people to know as we develop more medical conditions, those negatively impact breathing as well. So I think if people see it like that as a lifetime thing, that at different points in your life, your breathing could be challenged, I think it changes the dialogue on it. And I just think it needs people like you and I who've had personal benefit from improving breathing to spread the word. You know, I'm doing my best from a medical perspective in the medical world, but it's very difficult because trying to get studies on this, as you know, it's incredibly difficult to get funding, and we all breathe differently. So it's an active, not passive process changing unconscious breathing patterns. So it's not as simple as just giving someone a tablet. So, but I think it's hugely powerful.
Okay, thank you so much. That was very interesting, and of course, every person I talk about breathing gives different perspectives. Even if we talk about mouth and nose breathing, the same topics, but it's always different perspective, and there are new insights. Thank you so much.